Thank you all for joining us tonight. I say, let's get started. A very important topic tonight. We've got some great speakers who are here to give us expert insight and advice. Before we begin, I just want to introduce myself. My name is Sierra Bragan. I'm the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource. And so we encourage, equip, and empower moms. That's really our heart behind everything that we do. And we do that through resources. We have a website, and we also host events for moms and families. So we love to partner with amazing community organizations, and of course, organizations like Jackson Health to be able to provide these amazing resources for you. It is a joy. UHealth Jackson Children's Care really is doing amazing work in the community. What you may not know is their pediatric emergency room at Holtz Children's, also at Jackson North, are available to you 24/7, and they're all staffed with board certified pediatric emergency medicine specialists. So parents and children are getting access to every pediatric subspecialist at the Holtz Children's Hospital from the University of Miami Health System, as well as Jackson Health System. So interesting to know also that the Holtz Children's offers a 24-hour kids only emergency room. So I hope you never need an emergency room, but I know with our children, if we ever have to go with children, I always feel more comfortable going a place where I know my children will not be interacting with all sorts of other adult craziness that could be happening in a general ER. So great news to know that Holtz Children's is a 24-hour kids only emergency room. And then also at Holtz Children's, the doctors and nurses are certified in pediatric advanced life support. So you're really going to get the very best care possible. So hope you don't need that information, but tuck it away just in case you ever find yourself in an emergency. I hope you can make your way there to Holtz Children or Jackson North. Without further ado, I am excited to dive in tonight. COVID vaccine, fertility, and pregnancy, a very important topic. I'd like to introduce you to our two special guests. First up is Dr. Yvette Cordova. She is the medical director, Maternal-Fetal Medicine at Jackson. She is a fellowship, a board-trained certified physician in maternal-fetal medicine, and she's also a high-risk pregnancy expert who takes care of moms and their unborn babies at Jackson Memorial. Her goal is to educate parents and patients so that they can make the best decisions for themselves and for their babies. And she's also a mom of two young children. I think that's probably the thing that qualifies you the very most, Dr. Cordova. As a mom of two children, you know exactly how exciting and a little bit terrifying, confusing, all the things that a new pregnancy can be, right?
Definitely. Thank you so much, Tina.
Welcome. We're so glad to have you. And then also with us tonight is Joanne Ruggiero. She is the COO of the Women's Hospital at Jackson Health System, and she has over 16 years experience in women's health, nursing, and leadership. She holds a master's in nursing education and another one in leadership. She's certified in her field and has been published for her work on patient safety and staff engagement. And under her leadership, this is awesome, but under your leadership, the women's program have received national recognition for achieving and outperforming in quality and patient experience standards. That's something huge to be proud of. I'm excited to know that about you, and speaks just highly of your skills, and that you're here today as an advocate for women's health and to provide insight and any expertise in regards to the topic of vaccination and pregnancy. So I know this is a hot topic, so I know you have a lot to share. So Joanne, thank you for joining us.
For having me.
Oh, I can't wait, ladies. All right, again, if you are just joining us, please use that Q&A feature at the bottom. If at any time you have a question, we will do our best to field those and try to get to all of them. And then you can share in the chat if you have any comments. Additionally, if you have a topic in mind that you'd love to see us address in the fall, we're already planning. So drop that there in the chat feature. But otherwise, we're going to just dive right in. Let's get started. So talking about COVID-19 and fertility. We're going to talk about fertility, and then we're going to talk about during pregnancy, breastfeeding, kind of all the stages. But let's start first with fertility. And I want to know, Dr. Cordova, can the COVID-19 vaccine cause changes in our menstrual cycle?
Sure. So we'll start with the before, which is
Okay,
a great
great.
place. So it's interesting. I've actually heard, I've had friends, people, patients in our office notice that, there's been some changes with their menstrual cycles after having had the COVID vaccines.
Mhm.
And so there's been a wide variety of reports. So if you see in the news, there's been a lot of stuff going on regarding menstrual cycles and the COVID vaccine. We actually don't have any real studies on this, which is very interesting. So it's kind of, we're learning as we go that, things can be affected. And so one of the interesting things about, the changes, the reports that we're seeing is that they're pretty varied, and it can be anything from a heavy period to somebody reporting that maybe it came a little bit late, it came a little bit lighter. Maybe they even skipped a whole period, which wasn't usual for them. Now, the part that makes that tough is because we're seeing such varied responses. So the two most common have been that either it comes a little bit late or that it's coming a little bit heavier than expected. Now, we do know that other vaccines, such as the HPV vaccine and the flu vaccine, can actually affect menstruation. It can actually affect your period. So it's not the first time we've seen something like this.
Okay.
The part that makes this a little bit tricky is that periods are a little bit fickle. So lots of things can affect your period. It can be your nutrition, it can be your activity that month, it can be hormonal, lack of sleep, or it's just a lot of things.
A lot
So
of
it's
factors.
really hard to say, what these changes are related to, whether they be just changes that happen to coincide versus changes that, are actually related to the vaccine.
Mhm.
Most women that you talk to will probably tell you, I've had an off month once in a while.
Right.
It's not uncommon. But fortunately, what we are finding is that these changes are pretty limited. So we're seeing that they're pretty mild and usually limited to one period, maybe two. So in terms of the whole course of things, it usually tends to be the one right after. So that's good news and something, we don't really have to worry too much about.
Okay.
Other
That's good.
question that's kind of come up related to this is, should I not then get my period? I'm sorry, get the vaccine if I'm on my period, or, should I wait? Is there a particular time of the cycle? And we haven't found that that really makes too much of a difference. So you can go ahead and really do it at any point in time when you have availability for the vaccine.
Okay. Okay. Where did the rumor come from that COVID vaccine causes infertility? Because I feel like, I'll admit I heard it. And the second I heard it, I was like, oh, I don't know. I mean, maybe, I'm like, you could tell me a popsicle might cause infertility. I'm like, never eating a popsicle again. Right.
Right, right.
But
Well,
where did these rumor originate?
sure. So, fertility is something that's really important. And everybody worries about it. Am I going to do something that might do something that would affect it in some way, and then I won't be able to get it back. So it's something that's really near and dear. So this all came about from this myth that there is a protein in placenta called syncytin, syncytin 1, which is similar to the spike protein, which is part of the COVID virus and what the vaccine is actually based on. Now, this is a tiny, tiny piece of genetic code that is somewhat similar, but on all honesty is really quite different. So I guess the best way to kind of liken this would be to say that, let's say like you see somebody would confuse a songbird for a jumbo jet. They're two very different things completely, but they both fly. And that's kind of what happens in this case. Like your body doesn't confuse a placenta for, the COVID vaccine. And so there haven't been any reports of causing infertility. And that's one of the myths that we're really trying to debunk, because there is a lot of movement out there on social media regarding this particular myth. And it's really, I think holding people back from, moving towards getting vaccinated.
Yeah. Yeah. So on that note, I mean, I'm hearing you say that. So like, does it cause female infertility or does it cause male infertility? Can we say no to that?
Yeah, so we can say that it does not cause female infertility. I know we just talked about periods and they're like, well, if it changes my period, will it cause infertility? It hasn't been shown to cause any changes in fertility. Where you are is where you are.
Yeah.
And in terms of kind of, the period part, it's really limited to about a month or two, and that has more to do with the lining than ovulation and things like that.
Yeah. Okay, good. What if like a woman is considering pregnancy, Should she get the vaccine or should she wait or?
Sure. So if you meet criteria for the vaccine, which is basically most adults in the United States, you should definitely go ahead and get it. ACOG, which is the American College of Obstetrics and Gynecology, recommends strongly to go ahead. And oh, so does the Association for Reproductive Medicine. They're the group that actually focuses on fertility,
Okay.
to go ahead and get the vaccine prior to pregnancy. Part of the reason with that is you want to avoid COVID in pregnancy. So
Right.
if you can be vaccinated before, then you are not putting yourself at risk during pregnancy to have COVID, which can be a trickier situation.
That's right. Yeah. Then you're sick for two at that point, and nobody wants that.
Exactly.
Um, on that note, Joanne, I would love it if you would tell us a little bit about just the risks of COVID-19 in pregnancy. So shifting gears now to in pregnancy.
Yeah, so to feed off of Dr. Cordova's point, in pregnancy, we know that the risk of severe illness with COVID 19 really does increase.
Mm,
Um, Moms who are pregnant and develop COVID 19 really have higher respiratory complications.
mm,
Those complications are often leading to these moms having to be on ventilators.
mm,
And if you can imagine, right, being sick on a ventilator, all the stress that that's putting on a mother's body, and therefore it is really pushing, and we have seen cases of premature birth because of the stress that mom is under, as a result of the symptoms of COVID 19. So, it really is, to Dr. Cordova's point, if getting the vaccine before pregnancy really can have the effect to eliminate or reduce any symptoms that you may get in the case of having COVID 19.
oh, that's good. That's good. Joanne, tell me, can a pregnant mama pass COVID-19 to her fetus?
Yeah, that's like, such a hot topic
Yeah.
lately. And so many people want to know that, right? So, and the reality is so much is really unknown. We don't have a ton of cases that we can study, but what we do know at this point is that it is very uncommon for newborns to be born to a mom with COVID 19 to be born with any symptoms or coming back positive. Now, of course, mom can transfer the virus to their baby by holding them closely
Mhm.
and things of that nature. But for right now, there's not enough evidence that says that it does transfer through.
Okay. Okay. So that's some good news. What about, can women, I think I know the answer to this, but I'm gonna ask it anyways. Can women receive the COVID-19 vaccine if they're pregnant? Like during at any point in pregnancy, I guess.
At this point, we have no reason to suggest that you shouldn't.
Okay.
Um, a lot to what Dr. Cordova was speaking to a little earlier. There's no reason to suggest that you shouldn't get the COVID vaccine in pregnancy.
Yeah. So is it safe in pregnancy? I think you've made it clear, but I'll ask it.
Sure. So I'll kind of get into a little bit more about why we think it is safe in pregnancy. So the first part is when these vaccines first came out and they were doing the clinical trials, the reason that we don't have as much information as we would really like is that pregnant women were excluded from the trials. And
Right.
unfortunately, that leaves us with a really big void of information where we're trying to play catch up.
Mm-hmm.
So up until now, we haven't found any um, signs that the vaccine is unsafe. And so the way that we found that information has kind of come from different studies. So the first thing is there are animal studies that are looked at to make sure that there's no effects on the way that the babies are developing in terms of labor, things like that. And that all came back so far looking really good, that they didn't have any increase in complications. Now, since the vaccine has been out, we do have a monitoring system for side effects and for patients who are pregnant, a registry to make sure that we continue to get more information and continue to learn.
Great.
So up until I think beginning of last month, we had 123,000 women
Wow.
who had received the vaccine in pregnancy.
Okay. Wow.
We don't have all the information yet because a lot of these patients are still pregnant,
Yeah.
and so we don't have that yet. But just last month, there was actually an article published that did talk about these pregnancies, the ones that were a little bit earlier. And it looked at different things, which are, I think, some of the most important. So the first thing is miscarriage and stillbirth. So that's really important. And
Mhm.
it was either the same or lower than the background rate. So we compare that to patients who are not receiving the vaccine.
Okay.
Then from there, we looked at, well, what are the effects on moms? So gestational diabetes and hypertension, those all looked good as well. And then we looked at, what about the babies themselves? So are they having any trouble growing? So smaller than what would be expected? Are we having to deliver early? And then are there any anomalies, which means when the baby is being formed, were there any malformations? And again, there was no increase compared to patients who hadn't received the vaccine. The last one that they looked at was actually once babies were born, they didn't have any neonatal deaths in the group, which is really important as well. Um, so, from the information that we have, we do think that these are safe in pregnancy and can really help prevent severe disease, which is really something that we're very concerned about in pregnant moms because they are more at risk.
Mm-hmm.
The other thing that people have been kind of worried about, it's like, well, these are a new vaccine that, has something called mRNA, and how does that work exactly? Like, is that going to change my DNA or the baby when it's forming? Is it going to change his or her DNA? And so mRNA is not something that actually goes into the nucleus, like the brains of the cell. So, we don't get changes in anybody's DNA. You have your DNA from mom and dad.
Mm-hmm.
So that's really important. The other parts are that these are not live vaccines. So the vaccines themselves cannot cause COVID. None of the three can that are, in use here in the United States.
Okay.
So that means, if it's not live, you can't get it, which is really, really important as well.
Okay, that's good. I'm learning things. Yeah, I kind of feel like we've been getting so much information that sometimes I think, oh, I know all the answers to this, but I'm like, oh no, I'm learning new info. This is really great. And good to know that all that data is being taken on pregnant women who've taken the vaccine.
And
Because
we really try and encourage moms who are receiving these vaccines to register in, it's called VSafe, and there is something called the V Registry to make sure that we learn more so that, their experiences go heard and can help us guide us in the future as well.
that's great. That's great. Talk to us about what are the side effects of the vaccine in pregnancy?
Sure. So the side effects are very similar to what we're seeing with patients who aren't pregnant.
Okay.
So that includes some local reactions, which can be some redness, some soreness in the site. We've also seen the usual things that you hear other patients talking about, which is fever, some tiredness, some body aches, chills, also some nausea. Now, in terms of treatment for this, we say moms can use Tylenol or acetaminophen for fever if they're not feeling well, so that, the same things that we would recommend for non-pregnant patients.
That's great. So is the vaccine as effective in pregnant patients as in non-pregnant? Like, does it make any difference since the recipient is pregnant?
Sure. So the study so far, so what they looked at is after somebody received the vaccine, do they develop the antibodies that would then protect you from COVID-19? And they found that those levels were the same for patients who had received the vaccine and were pregnant and those who were not. The other part that's interesting about those antibodies is that we're starting to look at the babies of moms who have received it. And there are some antibodies that are crossing, and so we don't know yet how much protection that will provide to the baby, but
Right.
it's interesting to see that, this may be a way to also protect, small little newborn infants, because infants and small kids are not included in the vaccination right now. So
Right.
we don't really have a good way to protect them other than really taking precautions because they're not able to be vaccinated.
That's right. Is that similar? I say recently pregnant, 7 months ago pregnant. Like to hang on to that. I just had a baby. I'm like, no, I didn't just have a baby. But they're encourage you to get the flu shot because they say that those antibodies can transfer a little bit. Is that correct? Is that similar?
That's correct. So we have a little bit, the flu vaccine, and the other one is Tdap,
Right.
particularly for pertussis, which is whooping cough. We
Right.
have a little bit more information about how those antibodies can cross, but
Yeah.
the same idea that in the future, as we get more information, we may be able to say maybe this will help protect babies early in life.
That's great. That's great. Um, if you're just joining us and you have questions, drop those in the Q&A box. Now is your chance to put our experts on the spot. No, I'm teasing. But any great questions that you would like for us to put in front of them, we will do our best to get to those. This is such great and helpful information. I assume maybe some ladies who might be listening tonight are pregnant and are thinking, oh, you just have lots of questions. So it's just really helpful to be able to get some expert advice and answers. So I want to talk to you now about breastfeeding, um, and how the vaccine works with those who are breastfeeding. So, if you are breastfeeding, excuse me, should you get the vaccine?
Yes, and the answer is yes. And the antibodies that Dr. Cordova is talking about that travel through the placenta, we also know that antibodies also travel through the breast milk, right? And so we don't know the levels, we don't know the level of protection at this point, but we do know that there have been studies that are starting to show that the antibodies are passing to baby through the breast milk. And so there's no reason to suggest that if you're breastfeeding, you should not get the vaccine. And actually, we just encourage you, and the AAP, which is the American Academy of Pediatrics, actually encourage you to continue breastfeeding, even with getting the vaccine or if you have COVID. So there's really no study saying that you should stop breastfeeding in the event of either having COVID or getting the vaccine.
Okay, that's good. Yeah. Oh, it's so important for our sweet babies.
Yeah.
On the note of antibodies, we received a question from our audience. Would the antibodies transfer to a fetus at a later pregnancy? Like if you receive the vaccine now, but maybe another pregnancy later, could those antibodies transfer to a fetus? Do we know that yet?
Yeah, so we actually don't have that information yet.
Yeah. Yeah.
Um, the information that we have is that at some point in the second to third trimester, we have noticed that. And
Yeah.
again, the amount is the part that we're still not sure about. Will it be enough to protect babies?
Yeah, that's good. That's good. And one woman asked a question, talking about there's sites that some people report their baby was preterm or had miscarriages. So in light of that, like, is there a specific time in pregnancy that is better to have the vaccine? Like out of the first trimester, or is there any, research to say that there's a better time, or is it just any time's a good time?
Well, in terms of what we think, so there's a couple of aspects. So, in terms of miscarriage, the majority of miscarriages happen in the first trimester.
Mhm.
And what we've noticed is their rates are actually a lot higher than what we talk about. So, in a general population, you're looking at about a 15% rate of
Mhm.
miscarriage. And most people just, and it can be anywhere. It can be from very early, 4 or 5 weeks, all the way up to 10, 11, 12. And it's just something that we as women tend to kind of keep to ourselves. There's not a lot of conversation about that. So it may be higher than a lot of people realize.
That's
Now,
right.
the only reason to not get it in the first trimester is to just kind of never think like, oh, it was because of the vaccine that this happened. But if you
Right.
were to get it, we don't think it's unsafe or that there would be any side effect necessarily from the vaccine.
Yeah.
And in terms of trying to pass those antibodies, we think it's probably going to be in sometime this late second to early third trimester. So your body does have enough time to build them and pass them along. But that's still a little bit unclear as to what would be the best time.
Wonderful. Thank you. Interesting. Our bodies are fascinating. And it's just incredible all that we can learn about them. And I say we, I mean you, the experts, and then you
Yes,
come and tell us.
everyone's learning.
It's awesome. Incredible. So let's talk a little bit about one more question about breastfeeding. And I think you clarified this, but we don't have to stop breastfeeding if we receive the vaccine, right? Like carry on with the breastfeeding.
Carry on. Yes.
Awesome. Awesome. Good news. Okay, in terms of just what's going on right now with COVID-19 and vaccine, Dr. Cordova, what are just the common side effects right now? Like maybe you're pregnant, you're not, but what are the common COVID-19 side effects?
Sure. So I think that's really important to know, because then you kind of get an idea what you're in for.
Yeah.
Nobody likes surprises, and then especially some of these, symptoms can be a little bit uncomfortable,
Right.
and so you don't want to think, oh my goodness, what have I done? Is this right? Is this wrong? Should I feel this way? And so, like I said, they're very similar both in and out of pregnancy. The most common tend to be actually at the injection site, feeling some redness, some tenderness, soreness in the arm. And then other things are fever, some chills, nausea, body aches, tiredness. Now,
Mhm.
most people will have this resolve in about a day or
Mhm.
two. The most being 3 days, but the majority after about 24 to 48 hours are feeling fine, like it never happened.
That's good. Okay, that's helpful. On that note, you hear a lot in the news, and so I'm like, well, what's true, what's not? But can COVID-19, can the vaccine cause blood clots?
Sure. So this was a really hot topic around April, and it was related to the Johnson and Johnson vaccine. So
Right.
back around April 23rd, there were reports that were investigated about blood clots, and specifically, the majority of these patients were women.
Mm.
And so what they did find is that there was an association with blood clots. It's a condition called thrombosis with thrombocytopenia syndrome.
Okay.
Um, that said, it is very, very rare. So
Okay.
we're talking about 8 persons out of a million
Oh, wow.
that might experience this complication. So, even though it is a serious complication, the rarity, I can't stress enough. So, it is a safe vaccine. Like we talked about, it's not live. And it does provide really, really good protection from severe COVID.
Yeah, that's good because correct me if I'm wrong, you could still get COVID if you have the vaccine, but you're much less likely to have it in an extreme sort of scenario, correct?
That's correct, exactly. It's really shown to protect patients from having severe disease, which is really what we want. We don't want patients who are going to be in an ICU, who are going to require, breathing help, things
Yeah,
like that.
that's good. That's good. If you're listening and this is as making you think of questions, you can drop those in the Q&A and we'll get to them. A few more questions. Talk to us about the other side effects that are being reported. You mentioned like the blood clot thing, but is there any other things that are being reported about the COVID-19 vaccines?
Sure. So if you've got your finger on the pulse of the COVID vaccine, the latest side effect that has been reported has been an inflammation of the heart muscle and the sac around the heart. It's
Okay.
called myocarditis and pericarditis.
Okay.
And the reason I want to bring it up is because it's important to be transparent. So we're all learning as this goes along. So it's really important that we put it out there. Yes, these things can happen. So a little bit more about that. There's been about 1,000 cases reported of this. The majority are mild and have recovered already. And it tends to be actually in a different group. So whereas we were talking about women who were having blood clots, it's actually young men who are less than 30 years old, a lot of adolescents.
Right.
So kind of teenage to, young men where we've seen this complication.
Right.
That said, again, very, very rare. There's been like 177 million vaccines given. And so we have a few cases that are being reported. And I think a lot of this is, as we look at different groups. So before we had older generation who didn't
That's
have these complications. And so it may be different depending on how old you are, what we're really trying to focus on.
good. That's helpful. I'm so glad you spoke to that. When I was preparing to come, to lead the webinar tonight, my husband, he's putting the children to bed. So let's hope they're all to bed. But I was telling him the topic of tonight's webinar, and he said, ask about the heart thing that they're seeing in young men, and I thought, if it comes up, I'll ask. So I'm glad that you spoke to that. Like you said, just in transparency, trying to, everybody's learning as we are. So we received another question from our audience. Maybe you can speak to this or maybe not, but can you talk more about any of the variants of COVID-19? Specifically, this person's requesting about the Delta variant. If that's anything you want to speak to?
Sure. So a little bit about that. The Delta variant seems to be spreading a little bit faster and more aggressively than the original COVID variant that we had.
Mm.
So we are seeing a little bit more of it. We think that there is still protection from the current vaccines that are available. So we should be covered. And again, that's something that's ongoing to see as these new variants, because Delta may be one, but I'm sure that there's going to be others that we still continue to have protection against them. And again, the other part also becomes the more people that are vaccinated, the less places that the vaccine, excuse me, that the virus has to jump from person to person.
That's right. That makes sense.
So
Yeah.
it's
That's
almost
the whole herd immunity concept, right?
correct. It's almost like a fire. So you may see like when there's a wildfire that firefighters almost build, like actually burn around the fire so that the fire can't continue to spread. And this is kind of the same idea. If you can contain it, then it doesn't keep jumping from person to person.
That's good. That's good. It's helpful. Wonderful. Okay, another question just came in, but are you seeing any side effects for teenage girls? We're talking about fertility, and so you think, at 16 years old, I wasn't thinking about my fertility, but it's as moms now, we're thinking about our babies and, you know, but is there any side effects for teenage girls that you've seen with any of the vaccines, specifically the Pfizer one? This one is asking.
We haven't seen anything specific for young girls that's any different than the general side effects, and nothing long term.
Great. That's good news. Good news. Wonderful. Well, we've been super efficient tonight because you ladies really know your stuff and we've gotten to it. So I'm going to give just a couple more minutes. If anyone has any additional questions, I'm going to let you drop that in the Q&A box. Ladies, just thankful for your wisdom and your insight on this very important topic, but also just your leadership. It's just always amazing to see strong women leading in, very important parts of our community and of course in the hospital administration, as well as caring for moms. And specifically, we know moms specifically who are benefiting from what you're doing day in and day out right now. And so I just, as a mom, want to say thank you for your leadership and for the role that you play each and every day to serve families. So thank you for that. We appreciate that. And you have families yourself. So thank you for stepping away to be with us tonight to share your expertise. We appreciate you so much. Joanne, I just wanted to give you another moment if there was anything that you wanted to add, or maybe just speak to that maybe new mom who's pregnant for the first time and she's on the fence about, getting the vaccine or not. Just what would you say to her?
Yeah, it's why I'm grateful for platforms like this, because sometimes we kind of split between should you get it or shouldn't you get it, and the real answer is we want to make you as informed as possible for you to make an informed decision. And it's not very often that you get to talk to an MFM doctor just on the street on a Saturday, right? And so being able to use Dr. Cordova's expertise to bring it to this platform is really what we want to do, and we want to make our community informed and really walk side by side with you during this whole COVID-19. And if you're thinking about getting pregnant, if you're breastfeeding, or even pregnant, know that we at the Women's Hospital, we're here for you to answer questions, to be a support system for you, and to provide platforms like this, right? To give you the information that otherwise you probably wouldn't have had access to by a professional who really does this every day in and out. So
Great. Oh, thank you for that. These webinar series have been so instrumental and so helpful. The team at UHealth Jackson Children's Care is truly outstanding. I'm just thankful to have built friendship with them through this experience. But, it started as they made a great pivot during COVID to continue to bring this great resource. And moms and families and, individuals are here for it. And so they keep coming. And I'm just so grateful and thankful. And I just feel like the information, exactly what you said, like when do we get the opportunity to sit down with professionals and straight up, straightforward, ask our questions, get them answered. This is such an amazing resource. So if you're listening, I want you to know that at jacksonevents.org, you can go back and there is a library full of all of these webinars. You can go back and watch previous ones on all sorts of topics, everything from autism to fire safety to COVID vaccine to all the origins of COVID, where we started, what seems like a lifetime ago, but so many valuable resources there. So just thank you, because it's way better and much more safe for our heads and our hearts than to go diving on Google. So moms, just don't do it. Don't go dive on Google. But go check out jacksonevents.org and you can watch all of the previous webinars. Just a couple more questions and then we're going to wrap up. But this webinar specifically will be posted. Give us about a week or so, but you may get an email with a link, but you can also just check jacksonevents.org, pass that along to a friend, and they can come back and watch this one. So Joanne spoke to the pregnant mama who's not so sure about the vaccine. I would love for Dr. Cordova, could you speak to, we received a question from a mom who has a daughter who's being quarantined right now for COVID-19. And the daughter, she's 18, but the daughter is scared to get the vaccine because she's like, I don't know. So speak to this mom of how to encourage and advise her daughter.
Sure. So, I mean, I think one of the most important thing is to really put this in perspective in terms of the big picture. Like, we found ourselves in a really tough spot for the last year and a half. In the United States, there's been more than 27 million cases of COVID and 500,000 deaths. So it's a lot. We've all been through a lot in the last, year and a half with this. And, we keep thinking, oh, it was just, a lot of older folks, that this really affected. But with all these variants kind of coming out, what we're realizing is that this can affect everyone. It's not just old people and people who are sick. It can be anybody. It could, happen to any of us. And so, really thinking about what can we do to prevent this? And when we have something really as effective as a vaccine, really thinking twice, why wouldn't I do something where I could protect myself from having to have complications from this? Right. And I know that fertility is always something that's on our minds. Am I going to do something when I'm young that maybe would affect me later on? And as far as we know right now, these vaccines are not affecting fertility. Your natural fertility is going to stay the same. The menstrual changes that we might see, if in fact they're even related, we don't know that yet, seem to be very contained to maybe a month or two when you have an off month. And so, it's a really good way that we can prevent this from spreading and really having complications from it. Because, we know what can happen with COVID. That we know for sure. Like, we can get really, sick. It can be severe disease. And it's not just in adults, even kids. Kids have had, complications from this as well. It's not as common, but that doesn't mean it doesn't happen. Mm-hmm. And complications and side effects from the vaccine have really been very, very rare and usually pretty mild and limited to just a day or two.
Good. That's good advice. Yeah. Wonderful. One last thing I want to circle back on just for clarity. Okay, talking about antibodies, we received a question and we talked about antibodies can be passed to the baby. And you were saying, I think you said late second trimester, early third trimester. Is that correct? Kind of what the research is showing right now. Is there any research to show that they get like the same or less or more that way versus through the breast milk? Do we know?
I don't think we don't have that information yet.
Yeah. No. Yeah. Great. Well, there you have it. Awesome. Okay, last question. I keep saying last question, but this one really will be the last. It's great ones keep popping up. What would you say? Are there any, insights on what happens if you only get one of the two doses of the vaccine? Like, what if you only do half a vaccine?
Sure. So, in terms of, so there's two types, two kind of categories of vaccines. So the Johnson & Johnson is the what we call, it uses a vector that's different. It only requires one. So after one dose and 2 weeks later, you should have full immune response to it. Versus the Pfizer and Moderna, which use the mRNA, where it requires two that are at least, depending on the vaccine, either 3 weeks or 4 weeks apart. So what we think is that you may have some response to it. So about 50% of patients may be, have some immunity. The degree of immunity is the part that we worry about and how long it will last.
Yeah.
And it's also very difficult to say who will be the ones that will get the immunity versus those that don't. So
Right.
there is already some protection with one, but it's not a full protection.
Right. Right. Seems like standing in the rain with half an umbrella. Like,
Like
why
you
need
want
to
to
bring
get
half an
wet.
umbrella? Just leave the umbrella at home. Like, it doesn't help you. No, I'm teasing. Wonderful. Ladies, this has been incredibly helpful and insightful tonight. I just want to thank you again. And those of you listening, I want to draw your attention to 2 weeks from tonight, July 8th, will be our next parental guidance webinar on the topic of summer and water safety. So super important. We can never get enough. I have 3 little people. Only one of 3 of them can swim. And even with my best swimmer, I'm just always nervous about the water. So summer's here. And if you live in South Florida, you're going to be near the water. So drowning is the second leading cause of preventable death in kids through the age of 15. And it's important to learn water safety tips to keep you and your family and your children safe. So tune in. That's 2 weeks from tonight on July 8th. And we're going to have some great information about water safety. So don't miss it. Again, all of the parental guidance webinars can be found on jacksonevents.org. So you can click over there anytime and watch previous episodes, and stay tuned because this one will be there soon. So thank you again to Joanne and Dr. Cordova. We're so grateful for your time tonight. And to all of our guests who tuned in, we hope you enjoyed it and found it insightful. And we hope to see you in 2 weeks. So take care and everyone have a wonderful weekend. Thank you again.